5 indicators of imminent mortality in the elderly, subtle signs requiring immediate attention. Observe subtle changes in elderly loved ones. Discerning whether these are simply age-related or indicative of a more significant condition is crucial. The body often provides understated warnings of approaching mortality, frequently overlooked until the opportunity for timely intervention is lost. This video will delineate 5 subtle yet critical indicators potentially signifying a loved one's final year of life. Recognizing these signs enables the provision of necessary care, comfort, and support during this sensitive period. Let us proceed. 1. Significant weight loss. Unintentional weight loss is a significant indicator of end-of-life decline in the elderly. This often overlooked symptom, mistakenly attributed to natural aging, signals a critical decline in bodily function. Rapid, unexplained weight loss in older adults demands immediate attention. Weight loss in the elderly can stem from several factors. Impaired nutrient absorption. Age-related physiological decline can compromise digestive function, hindering nutrient absorption and leading to malnutrition, muscle loss, and overall weakness. Muscle mass reduction. While some muscle loss is a natural part of aging, accelerated muscle atrophy signifies a critical decline in physical condition, impacting mobility, immunity, and recovery from illness. Altered appetite. Diminished appetite, often accompanied by reduced taste sensitivity, results in decreased food intake. This is not merely a behavioral change but a physiological indicator of systemic decline. Underlying medical conditions. Chronic illnesses such as cancer, heart failure, or kidney disease can cause unexplained weight loss, often progressing subtly. Furthermore, psychological factors like depression or dementia can suppress appetite, contributing to overall health deterioration. When observing these indicators in an elderly family member, proactive intervention is crucial. Regular weight monitoring is paramount. Unexplained weight loss necessitates immediate and diligent tracking. Dietary adjustments should be implemented promptly. If reduced food intake is observed, a nutritional intervention is warranted, focusing on nutrient-dense, easily digestible foods, and potentially supplementing with protein-rich beverages. However, forcing nutrition is counterproductive if weight loss is a consequence of natural physiological decline. Instead, prioritize comfort and provide easily consumed, palatable foods. Furthermore, the presence of concomitant symptoms, such as fatigue, cognitive decline, or recurrent infections, demands immediate medical attention, as these may signify a critical depletion of bodily resources. Failure to address these issues promptly could lead to serious health complications. Therefore, a comprehensive approach involving regular monitoring, nutritional optimization, and prompt medical consultation is essential for managing unexplained weight loss in the elderly. 2. Extreme fatigue and debilitation. Extreme fatigue and weakness, a critical sign of the end-of-life stage. While fatigue and weakness are common occurrences in the elderly, their intensification to a point where daily activities become nearly impossible constitutes a significant indicator of the terminal phase of life. This profound energy depletion is not merely an effect of aging, it reflects the systemic weakening of vital organs. As the body's capacity to sustain normal functions diminishes, it prioritizes essential life-sustaining processes, diverting energy away from non-essential activities. This physiological shift manifests as a marked inability to perform even simple tasks, leading to significant dependence on caregivers. The severity of the fatigue and weakness, coupled with other clinical indicators, allows healthcare professionals to accurately assess the patient's prognosis and implement appropriate palliative care strategies to maximize comfort and quality of life during this challenging period. The progressive nature of this decline underscores the importance of early identification and proactive management to ensure the patient's dignity and well-being are preserved throughout the end-of-life journey. Extreme fatigue and weakness can stem from several critical physiological factors. Compromised oxygen and nutrient delivery. Inefficient cardiovascular and respiratory function significantly reduces oxygen supply to organs and muscles. This hypoxia induces profound fatigue, even at rest. Concurrently, inadequate nutrient transport deprives the body of the energy necessary for maintaining normal function. Organ system dysfunction. In advanced stages of illness, vital organs such as the heart, lungs, kidneys, and liver exhibit diminished performance. This compromises the body's ability to regulate crucial physiological processes, including blood pressure, body temperature, and electrolyte balance. The resulting organ weakness contributes to persistent fatigue and debility. Energy conservation mode. As the body approaches the end of life, it prioritizes energy allocation to essential life-sustaining functions over non-essential activities like ambulation, eating, and communication. Increased sleep, reduced responsiveness, and rapid exhaustion from minimal exertion are characteristic manifestations. Nutritional deficiency, significant weight loss, as discussed previously, leads to malnutrition, accelerating physical decline. Reduced food intake or loss of appetite results in insufficient protein, vitamins, and minerals, further compromising strength, mobility, and overall well-being, leading to debilitating exhaustion. Chronic disease impact, severe chronic illnesses, such as end-stage cancer, heart failure, kidney failure, or chronic obstructive pulmonary disease, drastically reduce energy levels. These conditions induce inflammation and impair the body's ability to convert nutrients into usable energy, resulting in persistent and profound fatigue. Sleep disturbances and cognitive decline, pain, dyspnea, and anxiety can disrupt sleep patterns, leading to chronic sleep deprivation. Furthermore, depression or cognitive impairment can exacerbate fatigue by diminishing motivation and interfering with the ability to engage in normal activities. The interplay of these factors contributes to a debilitating cycle of exhaustion and reduced functional capacity. Extreme fatigue and weakness in the terminal stages manifest as significantly reduced activity levels, including an inability to ambulate and even difficulty repositioning in bed. Increased somnolence reflects the body's energy conservation efforts, resulting in prolonged sleep and reduced alertness. A diminished response to environmental stimuli is characterized by decreased verbal communication and apathy towards external events. Exhaustion is experienced even at rest, with simple activities such as eating, conversing, or changing positions inducing profound fatigue. A weakening voice, becoming quieter, fainter, and more difficult to understand, further indicates declining physical strength. Families should take decisive action when a loved one experiences extreme fatigue and weakness. Create a calm and comfortable environment, ensure the patient rests in a well-ventilated, quiet space conducive to relaxation. Conserve their energy, minimize strenuous activities and provide assistance with mobility as needed. Maintain adequate nutrition. If appetite is diminished, substitute with nutrient-rich foods or energy supplements. Offer emotional support, address feelings of sadness or anxiety with gentle conversation, providing reassurance and affection. Monitor for health deterioration. If the patient exhibits symptoms such as dyspnea, significant pain, or progressive cognitive decline, families must be prepared for subsequent stages of care. 3. Cognitive impairment or emotional withdrawal. Cognitive decline and emotional withdrawal are significant indicators of a patient's end-of-life phase. These changes may manifest gradually or acutely. Cognitive decline presents as a diminishing capacity for thought, memory, recognition of loved ones, and responsiveness to the environment. Emotional withdrawal is characterized by reduced interaction, disinterest in previously enjoyed activities, and general apathy. These alterations are not solely attributable to aging but also reflect the deterioration of the brain and other vital organs. Cognitive decline and emotional withdrawal in terminal illness can stem from several physiological and psychological factors. Reduced cerebral blood flow. Cardiovascular compromise diminishes blood supply to the brain, depriving neurons of oxygen and nutrients, leading to confusion, disorientation, difficulty concentrating, and potentially severe memory impairment. Neurochemical imbalances. Terminal illness disrupts neurotransmitter levels, impacting cognitive and emotional function. This can manifest as depression, apathy, or behavioral changes. Organ dysfunction. Impaired hepatic and renal function allows toxin accumulation, negatively affecting the brain and causing confusion or lethargy. End-stage renal disease frequently presents with brain fog, impairing concentration and clear thinking. Severe nutritional deficiencies. Inadequate nutrition deprives the brain of essential vitamins and minerals, exacerbating cognitive decline. Medication effects and metabolic changes. Strong analgesics commonly used in terminal care can induce drowsiness, confusion, and cognitive impairment. Reduced metabolic capacity prolongs drug effects and intensifies adverse cognitive consequences. Emotional withdrawal. The awareness of impending death can lead to decreased motivation for social interaction and emotional retraction. Prolonged pain further diminishes engagement with previously enjoyable activities. Cognitive decline and emotional withdrawal, a comprehensive overview. Manifestations of cognitive impairment. Disorientation and confusion. Individuals experiencing cognitive decline may exhibit significant difficulties with orientation, struggling to recall time, place, and even failing to recognize familiar individuals. This disorientation can manifest as profound memory lapses and a general inability to process spatial information effectively. Impaired communication. Verbal communication is frequently compromised. Speech may become noticeably slower, characterized by disorganized sentence structure and significant difficulty articulating thoughts and ideas. The inability to express oneself effectively can lead to frustration and social isolation. Difficulties with concentration and memory, even seemingly simple tasks, such as retrieving a common household object, can prove exceedingly challenging. Short-term memory deficits are prevalent, resulting in frequent forgetfulness and a general inability to maintain focus on tasks requiring sustained attention. Personality alterations, significant shifts in personality are common. Individuals may become irritable, easily angered, and prone to outbursts of frustration. Conversely, apathy and a marked loss of interest in previously enjoyed activities are also frequently observed. These personality changes can significantly impact interpersonal relationships and overall quality of life. Manifestations of emotional withdrawal. Diminished interest in surroundings, apathy and a lack of engagement with the external world are characteristic symptoms. Individuals may exhibit reduced verbal communication, failing to respond appropriately to conversations or social interactions. This withdrawal can lead to significant social isolation and a decline in overall social functioning. Blunted affect, facial expressions become significantly reduced, lacking the expressiveness typically associated with emotional responses. The individual's face may appear impassive, failing to reflect joy, sadness, or other emotions. This lack of emotional expressiveness can be profoundly distressing for family members and caregivers. Unresponsiveness to care and concern. Despite efforts to engage and provide support, individuals may exhibit a marked lack of responsiveness to the concerns and affection of loved ones. Attempts at communication or interaction may be met with indifference or a complete absence of response. Increased sleep and social isolation. Rather than participating in family activities or social engagements, individuals may spend an inordinate amount of time sleeping or engaging in solitary activities. This withdrawal from social interaction further exacerbates feelings of isolation and contributes to a decline in overall well-being. How can families support affected individuals? Dedicate time for gentle interaction. Even if there is limited responsiveness, the presence and familiar voice of loved ones offer comfort. Utilize diverse communication methods. If verbal responsiveness is absent, consider hand-holding, gentle hair stroking, or music to foster connection. Establish a calm and comfortable environment. Shield the individual from overwhelming stimuli that may cause distress or confusion. Refrain from pressuring responsiveness. If they are unwilling to communicate or disengage from their surroundings, respect their need for personal space. Prioritize physical care to mitigate fatigue. Ensure adequate nutrition, sufficient sleep, and address discomfort such as pain or respiratory distress. 4. Frequent infections and impaired wound healing capacity. In the final stages of life, the body's weakened immune system significantly increases susceptibility to infections and impairs wound healing. Frequent infections, such as pneumonia, urinary tract infections, skin infections, and pressure ulcers, are common and often recur, becoming increasingly difficult to manage. Poor wound healing prolongs the recovery of ulcers, minor wounds, and surgical incisions, potentially leading to incomplete healing and increased infection risk. This clearly demonstrates the body's diminished capacity for self-defense and repair. Frequent infections and impaired wound healing are often caused by several factors. Weakened immune systems. In advanced stages of illness, bone marrow reduces the production of leukocytes, crucial for combating bacteria, viruses, and pathogens. This compromised ability to identify and eliminate pathogens increases susceptibility to infections. Poor blood circulation. Reduced cardiac function diminishes blood flow to organs and tissues, hindering oxygen and nutrient delivery for wound healing. Slow blood circulation also limits immune cell access to wounds, impeding infection control. Malnutrition and protein deficiency. Poor diet or loss of appetite in advanced illness leads to deficiencies in proteins, vitamins, and minerals essential for wound repair. Lack of vitamin C, zinc, and protein reduces collagen production, vital for skin and tissue regeneration. Dehydration and dry skin. Reduced fluid intake causes dehydration and dry skin, increasing susceptibility to cracking and bacterial invasion, leading to infections. Underlying diseases hindering wound healing. Conditions like diabetes, renal failure, and hepatic insufficiency impair wound healing and increase infection risk. Cancer patients or those undergoing chemotherapy or radiotherapy also exhibit reduced healing capacity. Immobility and pressure sores. Prolonged immobility predisposes patients to pressure sores, particularly on the back, buttocks, and heels. Untreated, these sores become infected and may spread. Immunosuppressive or prolonged antibiotic use. Immunosuppressant medications compromise the body's ability to fight infections. Long-term antibiotic use can lead to antibiotic resistance, making infections more difficult to treat. Common infections in the terminal stage: pneumonia, reduced cough reflex and pulmonary secretions increase susceptibility to pneumonia, particularly bacterial or aspiration pneumonia. Symptoms include cough, fever, dyspnea, and wheezing. Urinary tract infections, immobility and prolonged catheterization predispose to cystitis or pyelonephritis. Symptoms include dysuria, low-grade fever, cloudy or foul-smelling urine. Skin and pressure ulcer infections. Prolonged pressure on skin areas can lead to ulceration, facilitating bacterial invasion and infection. Symptoms include erythema, edema, purulent drainage, or foul odor from the ulcer. Sepsis. This severe infection involves bloodstream bacterial invasion, potentially causing multi-organ failure and death. Symptoms include high fever, tachycardia, hypotension, confusion, or coma. Signs indicating compromised immune function and impaired wound healing. Persistent non-healing wounds with purulent discharge. Recurrent infections despite treatment. Unexplained prolonged fever, chills, or excessive sweating. Widespread skin ulcerations exhibiting foul odor or black discoloration indicative of necrosis. Significant systemic weakness and diminished capacity to combat infection. Family members can significantly contribute to patient care through several key actions. Maintain meticulous personal hygiene. Daily bathing, clean clothing changes, and diligent hand and oral hygiene are crucial to minimize infection risk. Implement regular repositioning. Patients should be turned at least every 2 hours to prevent pressure sores. Provide a nutritious diet, increase protein, vitamin C, and zinc intake, ensuring adequate hydration to support immunity and wound healing. Practice proper wound care, sterilize wounds, change dressings correctly, and monitor closely for signs of infection. Maintain a clean environment, ensure the room is well ventilated, dry, and free from mold to inhibit bacterial growth. Avoid antibiotic overuse. Administer antibiotics only as prescribed by a physician to prevent antibiotic resistance. 5. Respiratory and circulatory transformation. In the final stages of life, organ systems, including the respiratory and circulatory systems, progressively weaken. This results in significant alterations in breathing patterns and blood circulation. Respiratory changes manifest as variations in respiratory rate. It may become rapid, slow, shallow, deep, or irregular. Characteristic breathing patterns, such as Cheyne-Stokes respiration or gasping, may also emerge. Circulatory compromise is evidenced by decreased blood pressure, impaired circulation, cold extremities, and cyanosis. These symptoms indicate reduced cardiac output. These physiological changes are integral to the body's cessation of function and typically occur in the final hours or days before death. Changes in respiration during the final stages. Cheyne-Stokes respiration. This common breathing pattern in the dying is characterized by breaths that initially increase in rate and depth, then gradually slow, culminating in brief pauses before resuming. This indicates instability in the brain's respiratory control center. Death rattle. This occurs when the patient loses the ability to swallow or cough, resulting in the accumulation of mucus in the throat. The resulting rattling or gurgling sound, while potentially distressing to loved ones, typically does not cause the patient pain. Gasping or shallow breathing. Progressive weakness compromises respiratory muscle function. Patients may exhibit shallow breaths or prolonged pauses between breaths. Some may exhibit open-mouth breathing due to loss of control over jaw and tongue muscles. Apnea. The patient may experience pauses in breathing lasting from seconds to minutes, followed by resumption of breathing. As death approaches, these apneic periods lengthen until respiration ceases entirely. Late-stage circulatory changes. Profound hypotension. Cardiac decompensation leads to a progressive and significant decline in blood pressure. Patients may experience dizziness, fatigue, or syncope. In the terminal stages, blood pressure may become unmeasurable. Arrhythmias. Heart rate may become tachycardic or progressively bradycardic as cardiac arrest approaches. Patients may experience palpitations or arrhythmias, resulting in an irregular heartbeat. Peripheral cyanosis and cold extremities. Compromised circulatory function prioritizes blood flow to vital organs such as the heart and brain, resulting in reduced perfusion to the extremities. This manifests as cold, cyanotic hands and feet due to hypoxia. Mottling. Impaired circulatory function causes mottled skin discoloration, characterized by the appearance of purplish or bluish patches on the extremities and torso. This is a strong indicator of imminent death, typically within hours or days. Causes of altered respiration and circulation: cerebrovascular dysfunction, progressive loss of brain function controlling respiration and heart rate manifests as various abnormalities. Hypoxia, compromised cardiac and pulmonary function results in inadequate oxygen delivery to organs, leading to altered respiratory and circulatory patterns. Pulmonary edema, fluid accumulation in the lungs causes labored breathing, dyspnea, and wheezing. Dehydration and malnutrition, insufficient nutrient and fluid intake leads to severe compromise of cardiovascular function. End-stage heart failure, inability of the heart to effectively pump blood results in organ failure and death. Impending death is indicated by Cheyne-Stokes respiration or periodic breathing, labored or gasping breaths, cold, cyanotic extremities, bradycardia or arrhythmia, a significant or unmeasurable drop in blood pressure, and unresponsiveness to external stimuli. How can families support loved ones experiencing respiratory distress? Maintain composure and reassure the patient. Altered breathing can be frightening for family members, but it is typically not painful for the patient. Remain present, offer physical comfort such as holding their hand, and speak in a soothing tone. Ensure patient comfort, elevate the head with pillows to facilitate breathing, maintain a cool room temperature, and minimize noise. Utilize supplemental oxygen or analgesia as needed. Low-dose morphine may be prescribed by a physician to ease breathing and discomfort. Manage respiratory secretions. Position the patient laterally and gently wipe secretions from around the mouth with a soft cloth. If necessary, the physician can prescribe medication to thin mucus. Maintain patient warmth. Provide light blankets for warmth, avoiding excessive layers as thermoregulation may be impaired. Early recognition of these signs is crucial for ensuring a loved one's final months are characterized by comfort, dignity, and affection. Viewers who found this video informative are encouraged to like, subscribe, and share it to disseminate this vital information. We invite your input on this subject. Have you observed any of these indicators in a person you care for? Share your experiences in the comments section below. Your contribution may assist others in managing this challenging process.